All right, our doctors of our personal injuries, Doctors Elite Community, exciting day today, exciting another presentation on an endorsement of a prominent figure that's out in the profession. And today we're going to introduce Dr. Richard Amy. Yes, he has two names, but call him by Richard, Dr. Richard. And
Yes.
Amy is his last name. Do not call him Amy. But anyway, we have him here today. We have to tell us that he is a prominent annual sponsor of our community now. So great to have him on board in our community with all the things he's going to kind of tell you and explain today about. A little bit about him. He's in the forefront over 30 plus years in the healthcare profession. He's one of the first to have a FDA clearance of a low laser therapy that he's going to show you today in the whole US of A. He's a top researcher and a clinician, and Dr. Richard developed the protocols for the laser therapy today that we will have all that for you to have in your practice. Great for personal injury, no doubt. Great for patient and accident injuries and all kinds of conditions that we will show you. But today he's going to show you what the laser can do and how it's worked on different conditions. And he is a innovation in the development of the kind of the new technology product, the True Laser Pro. It's a combination, and I happen to have granted gracious of his giving a laser myself and has been using it. Has dual lasers, pulsation, and a TENS all built into it. Pretty cool. So we've been working with that on different conditions, and we're going to let Dr. Rich tell you all about it. Okay, Dr. Richard, thanks for being with us. You're always your expertise, your education in the healthcare profession, and this great, incredible technology you have brought to the healthcare for our doctors to get a hold of that we will get you the information to get one. All right, doctor, you're on.
All right, Dr. Tony, thank you so much. I'm one of the old guys now, so I've been doing laser therapies for almost 30 years. I was introduced into lasers in 1998, and it was just sort of a fluke. And when I started getting the lasers, it was really pretty phenomenal. So my background, just so you know, is that I was based on chiropractor, so I think neurologically. And then I did the postgraduate course with Dr. Carrick, University of San Francisco in 95, 96, and 97. So I think neurological, and that's how I apply the laser. So in 1998, when I got the laser, people were saying, okay, you have a wrist injury, let's laser here for a minute and laser there. And I thought, man, we get some pretty good results that. But what happens when we really start lasering it from a neuromuscular pain syndrome, right? So we have a neurological problem, we have a nerve problem, we have a muscle problem that relates to a joint problem that relates to a pain problem. So I took my neurology and I did a lot of work in spinal rehab and that. I took Dan Murphy, took Carrick, I took a lot of different seminars. Really, Dan Murphy was really saying if you have carpal tunnel, it really only originates in the wrist about 20% of the time. And I thought that was pretty wowish, right? 20% of the time. So where does it start? It starts much higher up, usually in the neck. We could get some entrapments in the shoulder. We can get them in the elbow and then into the wrist. We call these double crush syndromes. And I'm sure you're pretty familiar about that. So I started taking the laser. Instead of lasering the wrist, I would laser right here. If I could laser one place in the body, it would be this upper cervical spine where the vagus nerve is, where this goes into the brain stem and into the spinal cord. It is an absolutely phenomenal spot. So when you start lasering here, I can take someone that has weakness, right, in their hands, laser them 2 feet away, and their strength will come back in literally 90 seconds. So I thought that's pretty wowish. I love treating trauma. Trauma is so much fun because it's really about looking at where the dysfunction is, restoring the function. And once I do that, the pain goes away. So in the beginning in 1998, we had quite a few studies on pain and neurological condition, repairing regenerated peripheral nerves, which we're dealing with all the time. And today, did you know that there's over 5,500 PubMed peer review articles on pain and neuropathies? It's absolutely phenomenal. In the old days, I had to go to the colleges, get Lasers and Surgery Medicine magazine out, photocopy them, make a bunch of copies, put manuals, and hand them out at the seminars. So we've really come a long ways. So lasers work phenomenal for pain. That is probably the top researching thing is on pain and inflammation and neuropathies, right? So we're talking about all sorts of neuropathies, sciatica, anything that has to do with carpal tunnel, anything that has to do with the nerve. The laser has a profound effect for really stimulating that nerve to increase the frequency of firing it, to close the pain gate, and to increase range of motion and muscle strength, and to help improve function and eliminate pain. So in 1999, I started doing clinical trials. I did 2 clinical trials for the FDA on neck and shoulder pain. And so people have been trying to get FDA approval for about 40 years, but they were mostly going on pain. And I'm very sensitive to the patient's pain, but I really could care less because I'm more interested in their function, right? So pain is subjective. My pain is different than my wife's pain, different than a middle linebacker in the NFL or a hockey player. Man, their pain thresholds are a lot higher than mine. And mine's a pretty good one because I've had a lot of traumas, played a lot of sports. So what I did is I took a playbook out of the American Medical Association guidelines to try to get FDA approval. So we looked at a VAS pain score, but then we looked at range of motion and muscle strength. Those were objective, and that's how they rated a lot of pain and still do today for disability. I worked a lot with Dr. Harold McCoy, who had Myologics. So we could actually do this on a computer. We could actually measure range of motion and muscle strength, and this was really the gold standard. So I did a clinical trial on this, and so we used precision pulsations. We used the laser, starting where? In the neck and the shoulder. We always start in the neck. We always start near the nerve root. Why do we do the nerve root? 2 reasons. That is one of the pain inhibitory centers, and that it also is where the beginning of the nerve goes, exiting the spine. Being a chiropractor and being in neurology, I know that the neurology is really the hierarchy, right? You can't have healing or immunization, right, without neurology. So no immunology without neurology. So we always want to laser the neurology first. So we lasered here. I also lasered the hindbrain, which is the cerebellum, which is the feedback loop from when you have trauma back into the cerebellum into the opposite brain. So we did this, we measured it. But the thing is, if you laser and you're doing some movement like therapeutic exercises, neuromuscular education, guess what? It works great. But if you have a placebo laser, no laser there, it gets worse. And I had no idea, being my first time doing the clinical trials, that actually our trials were so good, but our placebo was so low, less than 30%. But they saw, hey, we decreased pain, we increased range of motion, and we increased muscle strength, but our placebo was too low. So being the government, they made us redo it again. And I said, hey, we are not doing any movement, right? So we're just going to laser the areas. We're going to do pre and post muscle strength, range of motion, and look at VAS scores, not only that time pre and post, but 2 days later. And lo and behold, our placebo went up, which is great. And we were granted the first FDA marketing clearance. So those clinical trials were done in late 99 into 2000 and then 2001. This is a long period of time because it has to be IRB, double randomized clinical trials, multi-site, anything like that. It was a lot of work. But in 2002, we were granted the first market clearance for the treatment of pain, neuromuscular conditions, and arthritis. So from them, I've been writing protocols and I've been teaching laser therapy to probably close to 30,000 different healthcare practitioners. My base was chiropractic, so I was on the circuit for almost 10 years lecturing on how to use the laser neuromuscular wise for treating pain, neuropathies, and a lot of trauma, head conditions, vertigo, dizziness, brain fog. Those are all the wonderful things that the laser does. In fact, in my class was Dan Murphy. And so I brought Dan Murphy over into the laser field and I showed him some things that were pretty wowish. So I was at the Lions Inn in California taking one of his spinal trauma classes. And I said, Dan, you got to look at this, right? I says, I'm going to be doing these things and it's really, really wild. So we took someone out in the hall, right? And we had them doing close their eyes and touching your finger to your nose and bringing it back. And we had someone that was missing on the left side and was wobbling to the left and the other thing. I said, Dan, I'm not even going to adjust this patient, which I knew how to do to straighten that out. I'm just going to laser. I took that laser and I lasered that cerebellum for literally 2 to 3 minutes. We went back and rechecked, and not only that person was standing better in gravity because their involuntary neck and back muscles were working evenly through the cerebellum into the vestibular apparatus. The descending pathways are really for those involuntary neck and back muscles, which is you're all dealing with. We're all dealing with that problem. Anyone that's had whiplash, trauma, car accidents, sports injuries, whatever it is, this is what we're dealing in. And it was pretty mind-blowing. So I caught his eye, actually brought him over, and we lectured together for about 5 or 6 years, really had a lot of fun. And I learned a lot from him and he learned a lot from me. So in the beginning, it was really about understanding what function is. And when you look at how I teach you first how to exam, but you are the best at examining. So I don't have to teach you that, which is wonderful. You have diagnostic tools that can show range of motions. We can show muscle strength. We can show an ability to stand in gravity. We have different scales that we can use to see if I'm standing on one side in more relationship to the other. So the laser is a phenomenal tool for decreasing pain, decreasing inflammation, helping the body and all the cells to repair about 25 to 35% faster than normal. If you have a trauma, and let's say you're an elite athlete and you make millions of dollars, when do we want to treat you? We want to wait and see how it goes? No, we start treating you immediately. So if we can start treating people after a car accident, after a trauma, whatever it might be, the faster we start treating them, the faster the repair process. If I get you within the first 24 hours and I start treating you with the laser, I'm going to get you back on the court 50% faster, back on the ice rink, back on whatever sport you did. We did a great study with the Philadelphia 76ers many, many years ago on ankle sprains. And so one year they had this number of ankle sprains. The next year, they only had 10% less, which wasn't very much, right? So we didn't see a big difference in the amount of ankle sprains, but here was the key. Normally, it would take them 8 days to get back on the court. Using the laser and using everything that we know, treating neurologically first, then the muscle and the joint, we got them back in 3 days, which is absolutely huge. So we've been in the sports world for many, many years. It's really used out there. Many of the athletes, I would say the top ones, all own their own lasers, right? So lasers in the beginning, this is the first one I ever used. And maybe you can see this little one here. This was a PL200 right there. This little laser was one laser itself, and it cost about $5,000, right? It was not cheap, and that was back in 1998. So lasers started to take off and evolve, and as technology took off, we were able to put more than one laser in. We were able to increase power, but so did the prices of lasers, right? So they went from 5,000 to 8,000 to 13 to 15,000. And we really have a great range of lasers out there, really starting, I think, Avant is the best one in that class 3B. And it's really so versatile. So I wasn't waiting for the technology really to come down to really come up with a lower priced laser, an entry laser that was both for practitioners and for patients that had severe problems, right? Neuropathies, there is really not a whole lot out there in the medical community for neuropathies. We're looking at anti-inflammatories, we're looking at drugs, we're looking at things, but there's really nothing out there. Well, we know that the laser is so phenomenal for repairing the peripheral nerves. And those studies go back to as literally 2000 and 2001 with J.J. Andrews, who's the top researcher in that field, proved that when you crush the facial nerve in rats, so the rat got Bell's palsy, right? Everything drooped on one side. They would come back and laser it for 90 minutes. That was a long time because we had low power lasers. But after 14 days, not only did the peripheral nerve regenerate, obviously, the changing in the vat and everything happened here as far as the facial, the sensory, they could change. And then they knew that it went into the brain stem as well. We have 3 pain inhibitory centers in the body. One that runs along the dorsal horn of the spinal cord, and the other 2 are in the brain stem, right? So that's why we always go to the neck. That's why we go to the upper cervicals, because that trigeminal cervical nucleus is really, really important. It is yoked. So anytime you're treating head energy, we always look at the cervical, but I really implore you to also look at the TMJ. They're connected. They're a family. You can't, not affect one without the other. And so we'll find that many times when you've had head trauma, not only do you get TBIs, glutamate cascade, increase in cytokines, but we also get this relationship between the upper cervicals and the jaw. So really important to do that. So if I know where the pain inhibitory centers, doesn't it just make sense that we laser there? So the absolute best place for me to laser is really the anterior cervical spine here. Now, what is here? So this is the SCM, right, which is cranial nerve 11. It couples with the traps. Anyone ever seen someone in an accident have a really tight SCM and traps? 100%, right? They all have it. Well, guess what's above it? The vagus nerve. And where does that sit? It sits right there. The vagus nerve goes in towards the pain inhibitory centers. And then the vagus nerve stimulation is so huge. So if I have a laser, and this is a true laser, and this is such an unbelievable device. It has 2 lasers, 2 types of lasers. We have red, which is really great for muscle and for nerve, decreasing pain, helping the muscles to relax. And we have infrared, right? Infrared is for deeper structures, getting into the joint, increasing ATP. The ATP is the energy that helps the muscles to relax and helps the body to repair 25 to 35% faster. Like I said, there's almost 5,500 PubMed peer-reviewed articles on laser therapy, everything from neck and shoulder, which I did, to carpal tunnel, to low back, to plantar fasciitis, to rheumatoid arthritis. It is just unbelievable, the research anymore. Now people, when they say, well, where's the research? I said, just go to PubMed. Back and before, it was really limited, but now there's so much. It's so cool. So what I've done is I've taken this laser, and I'm going to flip it around here. So we have 6 red diodes, right? And 6 infrared diodes. And then we have a bar in the middle here, which is for electrical stimulation. The only bummer about the laser is that when you're lasering someone, they don't feel it 90% of the time. So what did I have to do? I'd have to take a weak muscle, like a myotone, like the shoulder, check it, and they're weak. I'd come back and I'd laser the neck and the shoulder, and then it would get strong in a couple minutes. That was the laser patient appreciation. Now with the TENS unit in here, they feel it and they can feel the nerve, right? And when they feel it, I start to get a sensation, or they start to get a sensation going up or down. And so it's sort of diagnostic as well as therapeutic. So we have this wonderful device that has 12 different diodes, 2 different lasers, and then really the key is that I pulse it. So I'm using my top 20 pulsations in here, or we call those frequencies. So it could be 4. 10 is a great frequency for treating the vagus nerve. 100 is a great frequency for treating the brain and other things. So we have 20 of the top precision pulsations in here, and that's really the cool part. So I'm going to turn it on. It's very simple. You hit the top button here, then we go down. I can change the time by 5 minutes. That should say 20. I come to the third button. That's the first bar. That's where you want to hang out. That's where I have my precision pulsations. And we have a manual, right, that has about 35 different protocols. Most of the whole front end is all about treating pain and neuropathies. And then we have 3 levels of TENS. Now, I have a good boost of TENS in here. And guess what? My TENS isn't stagnant like a square wave. You hold it up and it just goes to it. It's pulsing between 40 hertz and 200 hertz. So I'm trying to get the A fibers, which is light touch and vibration, the B fibers, more the muscle spindles, and the C fibers, which are pain. And that's why I'm pulsing it. And so sometimes people will say, ooh, I don't really feel it. And all of a sudden, wow, doc, I start to feel it. And then it starts to go up and then it comes down. So the laser is a photobiomodulator. That means it modulates cells and nerves. So in an inflammatory response, we have too much cell activity. We need to decrease that. And then a chronic. So if you get a chronic patient in there that I have chronic neck pain, shoulder pain, low back pain, it brings it up by increasing the energy through the ATP. Now, the red lasers hit the mitochondria, cytochrome Cs, increase ATP. The infrared does ion channels. So 2 lasers, like 2 heads, work better than 1. That's why we have 2. Then we combine the electrical stimulation, because when you're doing the electrical stimulation, we're stimulating the nerve, which sends an endorphin into where? The dorsal horn of the spinal cord, which inhibits pain for a long period of time. So this combination is just unbelievable, and we get phenomenal results, and we can see success usually, not usually, almost always on the first visit. I'm going to see a change in strength. I'm going to see a change in range of motion and a change in function. Now, the laser is accumulative, so we want to keep doing it on a regular basis, and that's why probably the hardest thing is really to keep the patient involved in what we're doing. But when they see improvement, they're more motivated to come back. Oh, I want to see how you do next time. And so I'm going to check certain things and keep them involved in what I'm doing. So we have all those great features. And then the greatest coup d'etat I've been working on, my 3rd generation, is called vagus nerve stimulation. Very, very, very popular there. So again, where are we going to go here? So let's take the laser, and I'm going to show you, and I'm going to talk just a little bit about vagus nerve stimulation because it is so powerful. So I have the first bar is this little sundial there. That's the laser. That's where you want to be. There's 2 other ones. I rarely use it. It's only for lipomas and some other things. And then I'm going to start with 1 bar of electrical stim, which is the 4th button. When I press the button, it starts to count down. So you can see that the laser is flashing, right? Those are the hertz. There's 20 different precision pulsations in this laser. And we know that pulse lasers work 10 to 20 times better than non-pulse lasers, right? There are studies that show when we're doing animal models and we're lasering the brain, and this has enough infrared to go through the brain transcranial for all those concussions and TBIs. I just had a great study that you'll see up on the website. So when we have that, it's really phenomenal. When we're lasing with pulsation, it increases the energy or the ATP in the brain from 40% on continuous laser to 150%, almost 4 times more energy to drive out that glutamate, those cascades, help detoxify, decrease the inflammation, and help the body to repair. So I come into the neck right here. That actually comes a little bit from behind. And you can feel it. I'm right on it right now. So I feel a sensation in the nerve right here, the vagus nerve. I'm also stimulating the SCM, which is great because that's going in the pain inhibitory center. And I know that this is way too tight, right? So the laser is creating energy, right? It takes energy to make a muscle contract. Guess what? It takes just as much energy to relax it. That's why we see changes in range of motion. We close the pain gate because the laser is creating that action, all right? So you can see it if I bring it a little further, it's pulsing. Now it's pulsing a little bit faster because we're moving up in the pulsations. Started slow, we're moving up, and that's what we're going to do. So when I'm here, you're going to have two different types of people, or maybe three. Some people say, I don't feel it at all. And I can tell you on my right side, which I have a bigger SCM in here, it takes me longer to feel the sensation. Other people will say, man, I'm so hypersensitive, they feel it right away. Well, guess what? It's a modulator. So people that feel it right away, it's going to calm them down. If it's too much for them, just pull it away a little bit. You have a large bar, or just take a little bit off. What I'm looking to do is for that nerve to start to stimulate and go up actually into my ear, called the Cymboconcha. This is where the vagus nerve part really originates. And we do this a lot with other peripheral nerve stimulators. The StimPod is probably the best. That device is $4,900. It is phenomenal, but man, this works so well. So the vagus nerve not only calms you down, right? It's the largest parasympathetic nervous system in the body. It connects brain to gut. It's the calmer. It decreases pain through the pain pathways in the brainstem. Those are inhibitory. It modulates and helps with PTSD, anxiety, depression, any type of mood disorders. This vagus nerve stimulation is absolutely phenomenal. It also has a big immune component. If you laser here, we're stimulating the gut, which increases microbiome, which increases microbifida. And guess where the serotonin and the GABA is predominantly made? In your gut. So if we're not stimulating the vagus nerve, we're not getting as much GABA and serotonin, the feel-good neurotransmitter. So what happens to our patients? They have to go on pain meds. They're on antidepressants because we know that does. So this vagus nerve stimulation is great. Now I've been holding on. I've been talking for a couple minutes here, and I can feel it going up into my ear. Well, that's the sweet spot. I'm telling you what, I'm sort of addicted to it. I sit there at the end of the day. I do this first thing in the morning and at the end of the day, and I'll sit there and I'll do 10 minutes of vagus nerve stimulation on both sides. Helps me sleep better, helps me sleep deeper, and it decreases the pro-inflammatory cytokines, decreases glutamate, decreases the all the under pro-inflammatory markers in the body. We've done studies on it. It's well pronounced. So this is phenomenal for overall health. It is phenomenal for pain and regeneration. And then guess what? There's actually an extra bonus. Below this, we have the stellate ganglion. So we're getting some afferent in the stellate ganglion, was for all those people that have complex regional pain syndromes, right? That inhibits that sympathetic pain, again, bringing back into balance. And you can't see it, but my ear is starting to twitch a little bit. I'm actually getting some muscle distillations really happening here, which is super cool, and I can cool it down. So again, I will see people's breathing just start to relax. Most people, when you've been in an accident, get what we call a withdrawal response, a flexor withdrawal response. This helps to break that. And when you break that, they'll start doing diaphragmatic breathing instead of using their accessory muscles. One of the first things I look at them, how are they breathing? If you're using your accessory muscles, right, your SCMs and your scalenes, then guess what? Their neck's going to be tight. Their traps are going to be tight. They're going to be in this guarded motion. Let's break that right away by doing vagus nerve stimulation. So anything I'm dealing with pain in the upper extremities, so the neck, the shoulder, the elbow, the wrist, I always want to start here. In the lower extremities, the low back, I'm going to come a little bit inside, about 2 to 3 inches below the belly button into the right if I have right pain, going down the leg, into the hip, into the knee, into the foot or the ankle, and the same thing on the other side. So we always start here, and I'm telling you what, this thing's going crazy, and I love it because it's so relaxing for me, and you can hear my vein calming down. No, just joking with you. But it is very, very relaxing here. So anytime we're doing that, we really want to make sure that we are getting good feedback. I'm looking for changes in breathing. I want them to do diaphragmatic breathing. I want to get them into a healing state. If I can't break that flexor withdrawal response, it's really hard for me to get them healed. And doing this, I can get them better, faster, And when they start feeling changes, guess what? They're usually more apt to come in. But you know how it is. We get people out of pain. They think they're done, they're fixed, and it takes time to regenerate and to rehabilitate the system. And so I'm always talking about function, right? So skin cells replaced old skin cell by a new skin cell every 28 to 35 days. Muscle, we're looking at 3 weeks. And if we're dealing with ligaments and cartilage, we're looking at what? A minimum of 3 months. Okay. So that's what we would like to do. Now, this is great on its own. Okay. So that laser is phenomenal. One of the coolest things that I've been using now for about 4 months that a friend of mine turned me on. He's a big motocross guy. He rides a lot of cycling and that. And I treated a lot of motocross people, and they are the Humpty Dumpties. I treated a lot of NFL players in the day. I treated a lot of baseball players in that. But I love this Lactigo. I don't know if you're familiar with the Lactigo or not. It's used by all the hockey teams, right? So I think Florida just won the Stanley Cup last night, but all the hockey teams use this, right? So if you go in there, all the hockey teams, not just one or two, all of them do. So let's say I have wrist pain, right? And I have carpal tunnel. Now, where's the problem? I know it could start up in the neck, and I can show you on videos later on how to do that, but it's really, I start here up in the upper forearm. This is where the median nerve is between the two heads of the peroneal arteries. So I'll take a little Lactigo here, and I'll take a little bit of Lactigo on the wrist, right? So I got the Lactigo there. I want to be rubbing here. I'm going to come, we have the ulnar and the radial nerve on the outside. We come into the wrist. I put the wrist on there, and I put this Lactigo on. So we call this photon phoresis. That means that we're going to use photons to activate this Lactigo. It works great by itself. The laser works great by itself, but if you combine the two, the synergistic, it takes it up at least another 30 to 40%. It's unbelievable, it really does. So I take the laser, right? And you can probably maybe not be able to see that. And then I start here. I always start higher, right? Now you can put it on here. Now I'm going to let the Lactigo get in. So I'm using these photons, which is a quantum amount, right? Smallest amount you can, to stimulate the mitochondrial DA to drive in and activate the Lactigo. The Lactigo is, the carnosine is really their big thing. It has menthol in it. And I've used everything. I've used BioFreeze. I've used Iontafreeze. I've used so many different topicals, but this Lactigo, I can feel it actually relaxing in those nerves going. So once I have that embedded into it, now I really want the E-stem. So I'm going to come where? Two heads of the median, right? Two heads between the median nerve between the two heads of the peroneal arteries. And I'm going to laser there for a couple minutes. I'm going to come into here. I'm going to tell you, it is so absolutely phenomenal. I think you're going to just blow your mind here with this one. So the True Laser is phenomenal. We have so many different things. We have the manual. We also have about 25 plus videos on how to use it that's included with it. We are just going to support you like you can't believe, and we're going to give you some discounts that I'm not giving to anyone else. Again, I have manuals, I have videos, we have a lot of support, and I'm here to support you. I'm at that point in my career. I just want to share. I've shared with a lot of doctors. I want to keep sharing with doctors and helping them help.
Dr. Richard, excellent presentation and demonstration for sure. And if you don't get more than that, you can see that your founder
Exactly
has one and has incorporated the lactical procedure, if you can see that. So you can see, as I asked my insurance agent, whose insurance do you have? And it better be his. The credibility is way high up there, and this is why we're bringing this endorsed into our doctors community. And very easy to use. We're using it now on some knee pain and tinnitus. We're going to start using on, and I know we're going to get phenomenal results of what I've been hearing from a lot of the testimonials from Dr. Richard's testimonial list, and of course we will be hearing from Kevin Atkinson, who is the founder of Lactigo, hopefully next week, if not. and really bring this to the forefront. And we want a lot of the doctors to incorporate this into their practices for personal injury. Not only that, for other conditions, as Dr. Richard has the manual that will get you copies of, so you can really see how it can work in your practice. No doubt there's codes, insurance codes, and in personal injury, you can use it for your attorney's documentation that it's needed for the accident injury, and get paid 100% in most cases for the treatment protocols. Just a great tool, very, very portable. Staff can use it when trained, and there's many other things that you can get from Dr. Richard Amy's protocols that you'll be part of. So we're going to have the link for sure. We're going to have his information and everything that you can have into this our PI Doctors Elite community that you can grab a hold of to put it in your office. You can buy 1, 2, 3, 4, 5 rooms full if you want to do the laser therapy that he demonstrated. But just glad to have him here and being part of our doctors community as an annual sponsor, and we glad to have great credibility into this doctors community. All right, Dr. Richard, do you have any more you'd want to add?
I said, let's laser on. Let's have some fun. Let's L&L, laser and Lactigo, and give them a little laser love Lactigo, and your patients are really going to appreciate it. So I enjoy it, 30 years into it. I'm excited for you. I'm excited to help and share and do whatever I can to help you and help your patients.
No doubt, appreciated, and we know how much work and dedication and time and effort that professionals like yourself put into these things, so you can bring it out to the healthcare profession to help, and of course the money involved that you invested in to put this true laser together. And I know I'm going to have fun with it. I've already been using it all over the place. Probably use on birds and dogs and cats and everything else, probably.
Oh, absolutely. Animals love it. It's funny. The animals will just start, they'll start laying down, and, I can use it for horses, big old horses.
Yeah.
They'll give me a big yawn and just stretch out. So
I would say anybody that has a nerve attached to it, this could be used possibly for results. So,
yeah.
All right. Well, we're going to get this out to our doctors community. We're going to be live on this session. It will be in our doctors community for sure. Dr. Richard will be around to comment and make any answers to any questions you might have one-on-one or into the community. And we're glad to have him on board as one of our prominent professionals in our profession. All right, with that, we will let you get back to your patient rounds, and stay tuned for more on this particular item on your emails that will be coming out, and a lot of great education in the True Laser Pro. So make sure you get attached to one to put it in your office and make things happen and make a lot of people very, very healthy. All right, Dr. Richard, thanks again for your time and expertise. Great demonstration. I mean, you can use this as a training for their staff, actually. Just simple little great presentation to help them out and knowing what the true pro laser is all about and all the things you've done. All right, we're going to end this session. We thank you very much for joining us. And again, we'll have everything, the information attached to this endorsement presentation, as we are now bringing in some great things as always. Look again for new events coming up. Dr. Tony, your administrator and founder, we're going to go ahead and end this session. All right, take care, make it happen, and stay healthy. Thanks, Dr. Richard.
All right, thank you.